project on the coolest anatomy stuff ever. First, we're going to talk about the general composition of bones. Here's a picture of a bone with the three main parts. Those would be osteoblasts, osteocytes, and osteoclasts. Bone cells are created by osteogenic cells, which are the stem cells of bone. First off, we have osteoblasts, which are bone-forming cells. Their shape is either cuboidal or angular. They're created by mitosis and the differentiation of osteogenic cells. They synthesize soft organic matter in the bone matrix. Stress and fractures cause rapid increase in osteoblasts. They secrete osteocalcin, which is a bone protein. Next, we have osteocytes. These are just osteoblasts that are trapped in the matrix. They live in very small cavities called lacunae. They're connected by gap junctions, which pass nutrients and chemical signals to each other. The function of osteocytes is to reabsorb bone matrix or deposit it. They help with regulating bone remodeling to adapt to stress as well. Next, we have osteoclasts, which are bone cells that break down the bone. They're pretty large because they're formed by the fusion of stem cells. So they contain 3 or 4 nuclei, and they have a ruffled border that faces the bone surface. This increases the efficiency of bone reabsorption. Bone remodeling occurs when bone dissolving and bone depositing osteoclasts combine actions. Next, we have the tissues of bones. The main tissue is osseous tissue, but there's also blood, bone marrow, cartilage, adipose, nervous, and fibrous. Calcification is the process of the tissue hardening in the matrix. It adapts based on things like tension and exertion on the bones. Next, we have the matrix, which is where calcification occurs. It's very dense and contains organic and inorganic materials. This organic matter is synthesized by osteoblasts. There are 2 types of bone, compact and spongy. We'll start off with compact. The basic structural unit is an osteon. It's composed of interstitial lamella, which are broken down osteons that are still in the region after the bone grew and was remodeled. It has a corkscrew shape that improves the strength of the bone. And the innermost osteocytes provide the blood vessels with nutrients. Spongy bone is named on the appearance. It's covered in bone marrow. The lamella is similar to compact bone, but it doesn't have as many osteons. In spongy bone, the osteocytes are very close to the bone marrow. The purpose of having spongy bone is that it adds some strength and you can have a bigger bone without adding a lot of weight. Lastly, we have the bone marrow, which is mainly found in long bones. There are 2 types, red, which produces blood cells, or yellow, which is fatty bone marrow. The red marrow is mainly found in the axial skeleton, while we have yellow marrow in the limbs of long bones. Next, we're going to be talking about the different classifications of bone. First off, we'll start with the long bones and their composition. So at each end of a long bone, we have spongy bone, and those ends are called epiphyses. And then the shaft is composed of compact bone, which is the diaphysis. In that shaft, there's a marrow cavity. And then on the ends of the bones, we have articular cartilage. And covering the entire bone, which is the outermost layer, is our periosteum. So now onto flat bones. Flat bones have spongy bone in the center, and then there's compact bone on the outside. So you can kind of think of this like a sandwich, with the spongy bone, of course, in the middle. And that's called the diplo. Its main job is to absorb shock. And then we have other bones, which is pretty much everything else. It's not a long or flat bone. And they mainly have spongy bone in the center with compact bone on the outside that provides protection. So a little more information about long bones. They're the prime movers, and they cover long areas. They're longer than they are wide. Their function is to act as levers to increase power in movements. Next we have short bones. They are equal in length and width, and then their function is gliding movements. Next up is flat bones. They are thin, can be curved, and they're kind of plate-like. The function of these bones is to protect our vital organs. Lastly, we have irregular bones. These are just bones that don't really fit anywhere else. They have multiple different functions depending on where they're located. For example, the 3 small bones in the ear, and then our vertebrae. Lastly, we're going to be covering synovial joints. The composition of these joints is that on the ends there's articular cartilage to make movement easier. Then there's a joint capsule that holds in synovial fluid to help reduce friction. And lastly, some joints have articular discs or menisci to reduce impact and help the bones fit together better. Some accessory structures that we have in joints are a tendon, which attaches muscle to bone, and then a ligament, which attaches bone to bone. Then we have bursa in a lot of areas of our body, which are between 2 muscles or bone and skin, or where a tendon goes over a bone. It's basically just a fluid-filled sac to help reduce friction. Lastly, we have a tendon sheath, which is a bursa sac that is wrapped around a tendon, which allows the tendons to move better in tight spaces. Different joints have different ranges of motions based on 3 factors. The first one is articular surfaces, which is the shape of bones. So if you think about your elbow, you have the olecranon process that kind of hooks into your elbow and locks it in place. And then we have ligaments or joint capsules. So that's how tight people's ligaments are. So this can really vary on flexibility and how much you stretch them and use them. So think about when you kick a ball, your tendons in your ligaments in your knee keep you from overextending your knee. Then lastly, you have muscles and tendons, which is the actions of your muscles mainly. So you have muscles that oppose each other. They keep the muscle tone for just general stability and prevent unwanted movements. There are 6 different types of synovial joints. We'll go through all of those. So first of all, we have a ball and socket, which is your hip or your shoulder. These are multi-axial, and they have a spherical head that fits into a socket. Next, we have condylar, which are biaxial. In their shape, they have an oval convex surface that fits into a concave surface. Lastly, we have a saddle joint, which is biaxial with 2 concave surfaces. Next are plane joints. They're usually biaxial. They have some slight movement. They're also flat or slightly convex or concave. Next, we have hinge joints. These are monoaxial, which means they move freely in one plane, once again with a convex surface that fits into a concave surface. And finally, we have a pivot joint. Once again, monoaxial. The bone spins on a longitudinal axis. Okay, now we have some general movements of all these joints. Flexion and extension, increasing and decreasing our joint angle. Abduction, which moving a body part away from the midline, and then adduction is moving the extremity back towards the midline. Elevation and depression. Then moving on, we also have protraction and retraction, so moving a body part anteriorly or posteriorly. Internal and external rotation, and then supination and pronation. And that concludes our Unit 2 project.